Hello, it's Emma here, and I am jumping on to do a 10 at 10. So, this is going to be 10 minutes of advice that I'm going to live stream at 10 a.m. Pacific on the days that I can. It won't be every day. If I already have patients booked in and things like that, it won't be every day. But the days that I can, I'm going to jump on live. And obviously, you can watch these back afterwards. So, I'm going to basically start from the beginning and kind of work my way through. So the first thing that you want to know is, do you have tennis elbow? And when we're looking specifically at tennis elbow, we're looking for a number of different things that basically correlate with that particular pathology. Well, what is tennis elbow? Let's even go back to that. Tennis elbow affects a tendon on the outside of the elbow. So basically on the outside of the elbow here, there's a bony part on the elbow. A tendon attaches to that. Well, what is a tendon? A tendon is a connective tissue. It attaches the forearm muscles onto the bone of the elbow. And so the tendon is actually quite small. It's only about a centimeter, quite a small structure, but it's a connective tissue. It attaches the forearm muscles to that bony part on the elbow. And when the tendon on the outside of the elbow is affected, that's basically the generic term for that is tennis elbow. The other names that you may have heard for this: lateral epicondylitis, lateral epicondylopathy, lateral epicondylosis. There's a lot of lateral means on the outside. Epicondyle is that bony part. So it's basically a problem with the bony part of the elbow. Now, if you have it on the inside of the elbow, that bony part on the inside of the elbow, the medial epicondyle, that's golfer's elbow. So depending on where you're feeling the pain, it's either on the outside for tennis elbow, on the inside, it's golfer's elbow. Now, there are other things that can mimic these symptoms too. So when you are seeing a healthcare provider about the pain in your elbow, they most likely are going to ask you, how's your neck? Do you have any neck pain? When you move your neck, does that affect the pain in your elbow? Because what we're looking for is all the pieces of the puzzle to bring together to see what exactly is going on with the elbow. Is there something going on in the neck that is causing the elbow pain? They'll most likely ask you about your shoulders. Is there something going on with the shoulder that could potentially be causing the pain in the elbow? That's a possibility. So we need to look at all of these elements to see, is there something else going on, or is it that tendon, that connective tissue that attaches the muscles to the bone? Is that what the problem is? Now, often we find that it's more than one thing. Maybe there is something going on with the neck. Maybe there is something going on with the elbow. Maybe those things predisposed you to then developing this issue in the tendon on the outside of your elbow, tennis elbow. It could well have been that. So we want to look at all of those pieces of the puzzle. You're most likely going to be asked, do you have any nerve symptoms? You say, well, what are nerve symptoms? Any tingling, pins and needles, or numbness. And that's not necessarily around the elbow. That could be into the hand. It can be into the fingers. So anything that's going on that side, on that arm, all of that is going to be it's all going to be part of the issue. So don't think that something isn't related. Like, oh, well, I've got this little bit of tingling in my little finger, but that's nothing to do with my elbow. It definitely could be. Or I've got this tingling in my thumb, or when I go to sleep at night, I feel this tingling or numbness. Tell them everything, because as I say, it's all pieces of the puzzle that we're trying to put together. It's very rare that somebody just has tennis elbow. It does happen in very early cases, when it's particularly overuse, things like that. It definitely can just be the tendon. But we don't want to miss anything, because if there's an element going on with the neck and you don't address that, your elbow is not going to be able to heal. So it's really vitally important that we look at all of these elements, pull everything together so that we're getting a really clear picture of which structures are involved, what needs addressing, what do you need treatment on in order to resolve your symptoms. Because at the end of the day, you've got elbow pain. That definitely can be local, and localized treatment is going to help that. But if you've got an element coming from your shoulder, an element coming from your neck, and that's not addressed, or even the nerves are involved and they're not addressed, you are not going to be able to heal that elbow fast, efficiently, and fully. It's always going to keep coming back if there's something that's not been addressed. So that is the most important thing when you are getting your elbow looked at to start with. So that gives you a little synopsis of what tennis elbow is, what it affects, and the things that we're looking for sort of clinically when you are seeing a healthcare provider. They're going to be asking you all of these different questions, obviously along with how long have you had it? What does the pain feel like? That's also an important question that we ask, because that gives us a lot of information as to, well, what type of structure are you feeling? Many people will say to me, I'm feeling burning in my forearm. Burning tends to be a nerve symptom. So that would lead me to dive a little deeper into, well, what's going on with the nerves? Is there a tendon and a nerve issue? Very often we see those things together. But that's why you're being asked all of these different things. And it's why it's so important to mention everything. I actually love it when I have clients who tell me about their back pain and their sciatica and their plantar fasciitis and all these other things, because even though you think, well, my foot is so far away from my elbow, that can't be related. Everything is connected, and we want to make sure that we have everything in there. So don't leave anything out. Start from the very beginning. If you're kind of like, oh, I had this 20 years ago, that's not going to count. Yes, it does. Let us know about it. Because again, we're putting the pieces of the puzzle together. And if we don't have a piece, you imagine if you're doing a jigsaw and there's a piece missing, how frustrating that is, and you can't complete the puzzle. So it's so important to give all of the pieces of the puzzle so that we can figure out all of the different things that are going on and address everything that you need addressing. So I hope that helps. If you have any questions, please don't hesitate to leave them in the chat, and I will answer them in future lives. Take care. I'll see you soon. Bye.